Good morning. Does COVID-19 affect the heart? Can the conditions be reversed if heart is affected? Please watch this to know more. Hi friends. In my earlier talks, based on latest work published in world's pioneer research journals, I explained how COVID-19 affects the brain, why pregnant women should take the vaccine, and how it gives immunity to the baby in the womb, and how the vaccine protects the pregnant mother too. Explaining these scientific researches of extreme importance, I would like to share with you the facts and bring awareness and help everyone to protect themselves and those nearer and dearer to them. In this talk, I will explain the havoc this virus plays on the heart. Basis of this is the latest researches done in the US among a huge population, that is 11,380,818 control subjects and patients. The magnitude of the study itself vouches for its reliability and importance. This work is published online in Nature Medicine on February 10, 2022 and in Nature 594, 259 to 64 pages of 2021. The study reports that even a mild case of COVID-19 may increase the patient's risk of cardiovascular problems for at least a year after diagnosis. CEY et al. Nature Medicine 2022, February 7, and also published in Pub Med PMID 351, 322-65. The study is based on the data collected from the National Healthcare of US Department of Veteran Affairs VA, conducted to build a cohort of 153,760 COVID-19 patients and two sets of cohorts of 5,036,647 contemporary control and 5,859,411 historical control individuals to estimate the risk identified beyond 30 days after the infection. This study found that patients with COVID-19 are at high risk of cardiovascular diseases including cerebrovascular disorders, dysrhythmias, ischemic and non-ischemic heart diseases, pericarditis and heart failures, and thromboembolic disease. The risk is elevated even for those who are under 65 years of age and who are free of the universally recognized risk factors for heart ailments such as obesity and diabetes. With the data so collected from National Healthcare Database, in which a total of 11,380,818 subjects were studied to estimate the risk, it was estimated that even after 30 days of infection, COVID-19, the patients are still at high risk for the earlier named cardiovascular diseases. The risk even remained elevated in those who were under 65 years of age and were free from the risk of obesity and diabetes. Whether the patient is young or old, smoker or non-smoker, the risk still exists, says Dr. Ziad Al-Ali, professor of Washington University in St. Louis, Missouri, and Chief of Research and Development at VA with St. Louis Healthcare System, ZY et al. PubMed.gov. People who recovered from COVID-19 showed considerable increase in those 20 cardiovascular problems. 52% more likely to have stroke, 72% increase for heart failures. Dr. Hossein Ardihali, cardiologist at Northeastern University of Chicago, Illinois, and also holds that the risk is very high in this case. The study emphasizes that healthcare providers should take necessary steps to avoid such catastrophe. If patients die a few days after complete recovery of COVID-19, it may be due to blood clots or other cardiovascular conditions. These conditions could have been avoided if in the light of the research papers available soon after the outbreak of pandemic. The healthcare providers now have great published results on huge number of patients, that is more than 11 million controls and 154,000 patients studied by Dr. C. Y et al. Among the US veterans. Other viruses like Coxsackie virus are major cause of myocarditis and other heart muscle defects. When these viral pathogens strike, patients usually develop chest pain, shortness of breath, and some other overt signs of illness. Patients diagnosed with COVID-19 induced myocarditis complain of cardiac issues, but they can also have a few or no symptoms of infection at all. This group of heart-related condition is termed as post-COVID-19 cardiac syndrome. Mitrani RD et al. Heart Rhythm 17, 1984 to 1990 pages of 2020. The two worst among those are heart decompensation and dysrhythmias. Heart decompensation is a sudden worsening of heart failure, and arrhythmias is uneven heartbeat, both of which trigger sudden cardiac death. From earliest days of COVID-19, it was well known that SARS-CoV-2 virus works havoc on the heart. Initial reports showed high levels of a protein, troponin, in the blood, which is an early sign for heart failure, arrhythmias, and blood clots in COVID-19 patients. Autopsies frequently found genetic materials of the virus inside cardiac tissues, showing that the receptors through which SARS-CoV-2 invade lung cells are also in abundance in heart tissues. Please subscribe, like, and comment on my channel. I will come soon with another edition of scientific research explained in simple, easy to understand language. Thank you very much for your time. I am Edwin Williams, EJW Science and Research News. Thank you.